Well, thank you very much for inviting me, ladies, gentlemen, dear participants, online and offline. Hello, everybody, because we're an international group. We at Weibernetz are very happy that we can make a contribution to this event, and we've been working on that topic for a very long time. Women and girls with impairments, what are their requirements regarding an inclusive healthcare system? On that slide, you see the logo of Being Left Behind, our conference today, and our Weibernetz Association logo. Everything that was said this morning and what has just been said applies also to women and girls with impairments. So why do we need a special input? The healthcare provision should be gender neutral. Here you see the symbol for men, women, and intersexuality, so a combined vision of that symbol for women and men. Well, healthcare provision should be neutral or should be provided to all gender, but it's insufficiently gender sensitive, all in all. So when it comes to research, therapy, or medication, women with and without impairments as a result of their biological gender, even without any diseases, they depend more often on services in healthcare when it comes to pregnancy, birth giving, different screening systems, or contraception when it comes to health services, healthcare. We also think of midwives or the gynecological doctors' consultation, but we tend to forget consulting regarding sexuality, family planning, or any courses preparing the woman to give birth or to go through pregnancy. That leads to under-resourcing, understaffing, and undersupply regarding the different aspects. Women and women's organizations have pointed to that special need and the insufficiencies for 40 years. You see this picture of the gynecological practice. So that's more or less how a woman in a wheelchair sees the gynecological examination. It's like climbing a summit, and for 40 years we've tried to improve the situation for women. This problem of being understaffed or under-resourced is also confirmed by a second source, and that goes back to the report of the federal German government regarding the situation of persons with disabilities dating back to 2016. Equal access is not in sight. Women with disabilities have longer waiting times, long transport times, and don't go to regular screenings usually. There was a research project in 2019 on the evaluation of specialized outpatient consultations and gynecological consultation on the gynecological and obstetric supply of women with disabilities. That was carried out in 2019. A joint initiative by the University of Bielefeld and the Ministry of Health, and the statement was that there are no evidence-based numbers regarding the supply situation, but we assume that there is understaffing, under-resourcing, and an insufficient supply of services overall. In order to illustrate the situation even further, and the real obstacles that we have to overcome, I have presented here an overview on the situation since 1998 until today. 1998 in Frankfurt, the first gynecological consultation office was opened. In 2007, 9 years later, in Dachau near Munich, a special consultation office was opened. Then in 2009 in Erlangen, 2011 in Bremen, a gynecological obstetric consultation office, and then in Berlin, and I don't know exactly, it must have been in 2010, another doctor's office that was specialized for women with disabilities. So I've got pictures here on the special picture with a photograph of a woman, disabled woman in a wheelchair in the consultation with the doctor. These different specialized doctors' offices have been opened as a result of the advocacy work of organizations of disabled persons to support the needs of women. And every time it took several years to open these different cabinets. The one in Dachau was closed a few years later, and Erlangen has no possibility to lift the disabled woman up onto the gynecological chair. Also, these offerings that have already been limited are being reduced even further. The consultation hours are very limited, sometimes only once a week, sometimes twice a week, but just for a few hours, and you need to have an appointment. In parts, there is no consulting offered to women and girls with learning disabilities, and the gynecologists work on a volunteer basis very often because their costs are not covered by regular funding of health services. And according to documents of the different networks, there are additional gynecological doctors' offices, but that are accessible or barrier-free, but they are not very well known to the target group. Any prenatal courses. Well, has one that was initiated in Frankfurt in 2010 for couples with impairments. You see the flyer here, the picture with a woman in a wheelchair carrying a baby girl on her knees. And when preparing for this conference, I did some additional research, and I found an information in the doctor's medical journal dating back to 2020, 27th of August. Here it says that the doctors want to improve the gynecological provision of services to women with disabilities. Well, I thought it's great. You see the picture here, a woman's hand that is placed on the wheel of a wheelchair, and behind you see the steps of the access to the cabinet. And it said, well, this, as for an improvement, there should be a list of gynecological doctors' offices with special offerings for women and girls with impairments. Well, that is the only improvement that was suggested by the medical association. So the question remains, is that sufficient? Women and girls with disabilities say, no, this is not enough. We've heard this morning that many of the problems are known. There are also lots of attempts to find solutions, but I would like to outline once more, in a more general manner, the different problems and the solutions that have been suggested. When it comes to accessibility or barrier-freeness, gynecological doctors' offices are very hard to access with wheelchairs, or they're never really entirely barrier-free. As a result of the additional financial expenditure when equipping this doctor's office, and at the same time the doctors have lower income. So the solution would be to create a corporate coverage offering of accessible gynecological doctor's offices. In the meantime, interim solutions could be thought of, for example, outpatient services by the different hospitals and additional remuneration for the doctors by using the different funding schemes. When it comes to technical skills or medical skills, there's a lack in skills with regards to problems such as pregnancy and paraplegia, or the interaction between medication due to disability and contraceptives, etc. Many of the different activities for pregnant women are not usable for women with disabilities. Here we could imagine to have the inclusion of women and girls with disabilities as a target group into the medical and therapeutical training offerings. So here you see also a picture from a magazine, a woman in a wheelchair with a child on a bicycle somewhere in the fields, roadmap towards children's happiness is the problem. I can't read what is written here in the second line. The worldwide first global directive for women with paraplegia, which is a milestone in development and improvement. Thank you. Well, so it's a first guideline. First guideline, imagine, in 2020, maybe it's a good stepping stone for additional solutions or additional information. When it comes to prejudices or preconceived statements, well, there are prejudices when it comes to parenthood, motherhood of women with impairments. Very often doctors, female and male doctors, discourage women with learning impairments to get pregnant. Requirements regarding informed decision-making are not complied with. Medical standards that are usually applicable are no longer in force. For example, certain medication that is not given to non-disabled persons, but that is prescribed to women with learning disabilities. Here we suggest that women and girls with disabilities are included into the catalogue of initial and further training of gynecologists, midwives and other relevant medical groups. Then offerings regarding information supply, information about pregnancy and birth, contraception, etc., are not accessible for girls and women that have visual impairings or are deaf, as well as girls and women with learning disabilities. Here we suggest that all of the different websites, all information in the field of gynecology, sexuality, pregnancy, etc., should be barrier-free. Good practice examples that do exist should become a regular practice. For example, the project of Donum Vitae to consult women and men with learning disabilities. So how to finance that additional effort that is necessary, or how can we finance this additional effort sustainably? Then information as a result of trained, skilled, specialized healthcare givers or providers. Now, the implementation of the United Nations Convention on the Rights of People with Disabilities, Article 25 on health, and it clearly illustrates what it is all about. It's about rights and not about something that can be done on the sly or can be done just in a secondary way. So in clause A of Article 25 said free of charge or affordable health care must be given to disabled persons as to everybody else in the same range and same quality, same standards need to be applied. And that includes sexual and reproductive health care. And in C it says the signatory states must provide the health services as close as possible to the communities, even in rural areas. My last slide includes 5 symbols for use of wheelchairs, for deaf persons, for blind persons, for those needing interpreting sign language, and those who have learning disabilities. And you see that these different symbols sort of jump into the slide here. Thank you very much.